Hey, Blake from Respiratory, can I come in?
Sure,
Are you Edna?
I am.
Hey, how you doing, Edna? I'm coming by. I got a little advice for you to do a little assessment, see if we can kind of get your breathing doing a little better here. Can I see your wristband here real quick?
Sure.
What's your date of birth?
12/21/1931.
Yeah, that sounds right. That's you. So I'm gonna show this little device to you here to see if we can kind of get you helped out. Have you been coughing up a lot of stuff or something? Is what your doctor told me.
Yeah, a lot of stuff coming up. It's
Okay,
gross.
well, I have a little souvenir here for you, the Roebuck. I'm going to show you how to use this thing here in a second, and we'll see if we can kind of get you helped out into something I can kind of leave with you. I'm going to do a little assessment on you here first, okay? I'm
Okay.
going to borrow that wrist again, just check a heart rate on you with my watch. You've been having any trouble breathing or anything?
It is hard to breathe a little bit. Yeah.
You've been looking at that stuff you're coughing up?
Yeah, it's kind of yellow and thick.
We'll see if we can get a little sneak peek at some of that stuff here in just a little bit. All right, I'm going to take a listen to those lungs here real quick. Just a couple on the front and a few on the back. All right, nice big deep breaths in and out for me. You a smoker right now?
Well, back in the day, we were all doing it. So maybe a little bit here and there.
Big deep breath for me. All right. One more here. All right. I'm gonna have you lean forward, take a listen on that back here. Actually, the best lungs I've heard all day.
Oh, well, I try.
All right, one more on the side here. Okay. You can go ahead and lean on back. I'm gonna get that out of the bed up just a little bit more here. That's about as high as it goes. That comfortable for you?
Good.
Okay, so I'll kind of show you this thing here. All right. And then I'll have you take your mask off and I'll have you kind of practice. Okay, so I'm going to send this home with you. It's the aerobica. What I'm going to have you do, I'll give you some kind of better instructions once I get your mask off. But I'm going to have you see your lips around this mouthpiece. You're going to take some nice deep breaths in. And I'm going to have you just kind of blow through this thing forcefully, okay? And you're going to feel a couple of things. You're going to feel it make a little bit of back pressure in your chest, and you're going to feel some vibrations. Hopefully, we're getting some air underneath all that yellow junk that's down there in your lungs. And as you're kind of blowing out, you're going to get these vibrations. We're going to help kind of clear those lungs out for you, okay? So I'll show you a couple other little things about this once we kind of get going and everything. But the cool thing is with this, you can take it home and actually clean it. All right. Right now you're sick and everything, so we don't want you taking this home and using some dirty piece of equipment for a long period of time. See these little clasps right here? You can take that apart. You can put that in the top rack of your dishwasher. Make sure it's nice and dry whenever it's done. And you honestly cannot put this thing together wrong. It doesn't allow you to or anything. Okay, so it's something you actually get to take home with you. Okay, so whenever you do this, you always want to kind of be sitting up nice and upright, kind of how you are here right now. Okay, but if you get feeling better in a few days and you can get up in a chair or the side of the bed, even better. Now, if you take off your COVID mask there. All right, so just kind of sitting how you are, I'm gonna have you hold on to that here. Okay, take a nice deep breath in, slight pause so your lips are on the mouthpiece, and a nice kind of forceful exhalation. Okay, so that was a nice effort there. All right, but got to improve upon a couple of things. So first off, so you make sure you get your lips nice and sealed around that mouthpiece. Make a nice tight seal. Okay. Now, nice big deep breath in, and then kind of squeeze that air out. Don't blow like you're blowing a spitball or anything, but kind of force that air through. All right, stop gumming that thing now.
I don't feel anything. I'm blowing out, but I don't feel anything.
Okay, so what we're gonna do here, all right? I was going to show you this after we do this, but there's an ability to change the degree of resistance blowing through there. So you might be feeling a little frail and stuff, you know. And I mean, at your age, it's when you get a little sickness, it's tough to kind of blow through stuff. We're going to move that little indicator. See the little plus in my here? I'll hold it real close for your old eyes to see there.
Okay.
If you move that all the way over to this easier setting, it's not going to be as much back pressure. You'll feel a little bit more forceful vibrations. But once again, you need to seal your lips around that mouthpiece and really kind of squeeze that out. Squeeze those muscles you got there. That's a little bit better. How'd that feel?
I can feel it wiggling.
Okay, not too hard to blow through or anything like that?
No. Mm-mm.
Okay, so we're going to keep it on this easy setting and we'll see if we can kind of adjust it. What I want you to try and do is keep repeating that, all right? And I want you to try and do, we'll see how you're feeling after 10 breaths here, okay? But you got to keep kind of squeezing that through. Make sure you're taking those deep breaths. There you go. Keep blowing a little bit harder there, okay? We really want to get some of those forceful vibrations. That's a little bit better. You feeling okay still? Doing good. See if you can really kind of squeeze that air through just even a little bit more, as long as it's not tiring you out. Feel how those vibrations a little more forceful. Takes a little longer to get that air out. Those are all the things we want to see here. Give me a couple more, and then I'm going to try and change that level of resistance to see if you can kind of blow through now that you're getting the hang of that thing, okay? All right, I'm just make a tiny little adjustment. I'm just to
A
show you
little
the other.
dizzy.
Okay, I'm going to give you a little break here, okay?
Okay.
Probably haven't been breathing nice and deep and fast and stuff like that for a
Not
while.
unless I have a cigarette. But
Yeah, well, we can see what we can get for you here a little later today, okay? So while we're taking a little break, and sometimes, trying to do more than 10 of them, especially at first, is a little much. So what I'm going to have you do is try and see if we can clear some stuff out. I could hear a little bit of some stuff rumbling, actually, while you're blowing on that thing. Okay, so I'm going to have you take a nice, big, deep breath. And I want you to do a big cough for me, okay? And I'm going to give you a little bit of a couple of pointers on that cough.
You're not supposed to cough.
Yeah, okay, so I don't know if anybody's ever told you about a huff cough, okay, but a huff cough sometimes it's coughing, but instead of kind of keep it kind of really close your airway up and building all that pressure in your chest, it kind of keeps everything opened up, and sometimes it helps. Okay, I'm gonna step away so I'm not coughing on you, but it's really like you're saying huff. Okay, so take a nice big deep breath, slight pause.
Okay.
And if you're having trouble getting a big cough, if you kind of use your chest to kind of create some of that pressure, it'll really help. And please keep that mask on. I don't know what type of things you have
Yeah,
or anything. The pathology report isn't back yet, but
really should.
not promising. You need a little work on that, okay? So the key, once again, nice deep breath. You got to fill up the lungs if you're going to try and get any stuff under there and get that stuff out, okay? Nice deep breath, slight pause, and then really kind of squeeze them. Yeah, we'll get you there, okay? So you feel a little bit better, and you can swallow that stuff down if you want. I'll take a look. I'm sure we'll get some more stuff up in the end. As long as you're getting it out of your lungs, it's not going to cause any trouble down there in your stomach or anything like that. All right, so you feeling a little bit better with the lightheaded and dizziness.
Yeah.
If you find yourself doing that stuff while you're by yourself, because I'm going to leave this with you at the bedside, I think you can do just fine. If you find yourself getting lightheaded, dizzy, just make sure breathing too fast. Try and take some breaks. Take it nice and easy. You got nowhere to go. You're stuck here, okay?
Sure.
So
Thanks.
let's try this more forceful kind of resistance and everything.
Okay.
And I'm gonna, it might be a little bit more tough, okay? But go ahead. I'm gonna have you take your mask off. And let's just try and shoot for another 10 if you can do it. And remember, so you're gonna take a nice big deep breath in, slight pause, and then kind of squeeze that air out. We want to feel those vibrations and that back pressure, and it should take a long time to get that air out. Okay? Feel the difference there from before, so it's taking a lot longer to exhale and everything. You want to squeeze that air out a little bit better. Is that too difficult for you? A little tough?
A little bit.
Okay. Let me make just a tiny little adjustment. And you can kind of play with this. There is no right or wrong. It's what kind of works best for you, okay? So let's just put you smack dab in the middle and kind of see how that works for you. That seems a lot better. Really good vibrations. Don't look like you're struggling too much. Remember, you don't have to breathe too fast. If you're going to get lightheaded on us and stuff, you can go nice and easy. So usually what we like to do is 3 sets, 10 to 20 repetitions or breaths on that thing at a time. At first, you may have trouble kind of getting, up to 20 and everything like that. But it's something that we'll come back and kind of evaluate you and everything, make sure you're doing well, and this is kind of meeting your needs. But this is something you can kind of work on throughout the day. If you feel congested, give this thing a try. What you want to do at the end of those sets, whether it's 10 or 20 or anything like that, try and work on that cough. And remember, you need to take a nice big deep breath, slight pause, and really try and work on getting that big forceful cough and getting that stuff out of there. And then be sure to show your nurse. That always grosses them out. how's that setting feel for you? Pretty good?
That's good.
Okay, so let's go ahead. I'll set this off to the side. Go ahead and try to take that nice big deep breath for me again. Big strong coughing. Here, spit that. No. Okay, so I'm gonna leave this with you here. I just want to do a follow-up little assessment. Okay, you feel like that is something that's you're willing to work on and
Yeah, I
everything
was
like that?
able to get that stuff, but that's been hard to do, so.
Very good. Glad I could help you. A
Yeah.
couple more breaths here. Oh yeah. Couple on the sides here again. All right, a few more on the back. Oh, sorry, I got a little sputum on your hair there.
Okay.
All right, one more big deep breath for me. Nice and easy, in and out. Never heard anything like that on that right side before. I'll have to tell the doctor about that.
Oh, okay.
But you have any questions about how to use this thing or anything?
No, I think I'm good. How often again did you say?
So really, the only thing you can do that would make you do this too much would be if you're getting lightheaded and
Okay.
dizzy.
Okay.
Work on this thing all throughout the day, but we'd like to try and do at least 3 sets of 10 at a time. If you can do it every hour or as you're feeling the need, we're going to come back and kind of see and evaluate you once a day and see if anything's getting worse. But if you figure you don't have anything else to really work on in here, you can do
Good.
this as
Yeah.
often as you really like, okay?
Perfect.
Any questions for me?
I don't think so.
Okay, well, I'm going to leave this with you, and I'm going to just take one last set of vitals on you here, okay?
Can you help me with my bedpan?
Sure. Number 1 or number 2?
2, for sure.
Okay, let me show you how to work this call light here. Okay, well, I'm going to get some stuff charted here and everything like that. I'll let your nurse know about your impending bowel
All right,
movement.
I got a turtle
And
head.
we'll see you a little bit later here, all right? Just try and kind of keep that squeezed and be just fine.
All right.